Hi everybody, this is Dr. Jamie Marich, and in this video I will be walking you through a full progressive muscle relaxation exercise. I would allot about 15 minutes for completely doing this exercise through. This is an old hypnotherapy related technique that goes back to the 1920s, and it is one of the most splendid exercises that I've ever learned when it comes to really helping to promote nice, natural, healthy sleep. What I'm going to be doing here is leading you through an exercise where we clench one muscle group and then release another muscle group. So I would advise you to get into a comfortable position because the hope is that at the end of this exercise you will be feeling a nice state of relaxation, preferably of the kind that you feel just before sleep. So I'm going to invite you to take a nice couple deep breaths just to settle in. And I'm going to invite you now to clench your left fist. You don't have to hold it up like this. I'm just doing this for demonstration. But clenching your left fist and holding it here. Holding. Holding. And then with your exhale, slowly, gently, releasing. Nice deep breath. Coming over now to your right side, clenching the right fist. And then with your exhale, slowly, gently release. Nice deep breath. Inviting you now to come into your left forearm, clenching that. If you have to clench the fist too, that's okay, but really try to isolate the contraction here in this forearm. And then with your exhale, releasing. So moving now to the right forearm. Just clenching the right forearm, contracting. And then with your exhale, release it, let it go. So coming now to your left upper arm, trying to isolate the contraction here from your elbows to your shoulders, clenching. And then with your breath, releasing. Coming over to the right side now, isolating the contraction here in the upper arm from your elbow to your shoulders. Clenching. And then when you're ready, gently release. So I'm going to move to the face next, and then the easiest way to do this is just think squeezing in the face. Furrowing the brow. And then with your exhale, let it go, release. So I'm going to move now into the neck and chest, and the way I do this, just careful not to spike the shoulders, but squeezing in like so. And then with your exhale, let it go. This whole kind of upper body that we've just worked. So moving now into the stomach, you can go ahead and suck that in. Again, we're kind of exaggerating the tension here, exaggerating, holding on. And then with your exhale, let it go. So coming now, let's start on our left side, coming to the left thigh. Just think about squeezing the left thigh, the quads, the hamstrings. Even if it feels like totally squeezing isn't possible, at least just bringing some tension to that part of the leg. And if you're laying down, this may be easier than if you're sitting up. And then with your exhale, let it go. Coming now to your right thigh, go ahead and engaging, squeezing. And with your exhale, let it go. Okay. So now coming to the lower parts of your legs, isolating your left leg from your knee to your ankle as best you can, clenching in the shin, the calf. And then with your exhale, let it go. So coming now to the right, the lower leg from the knee to the ankle. Whatever way you can, just contracting that area around the shin, the calf. Holding, clenching. And then with your breath, letting it go. So now gripping in the left foot. And if you're laying down, this may be easier. If you're sitting up, you may want to think about just curling those toes under. Be really planting the foot into the ground, whatever helps you think of clench with that left foot. And then with your breath, exhale and release. So coming now onto the right side, clenching, contracting, isolating that right foot. And then with your exhale, let it go. Let it go. So now we're going to squeeze the whole body entire. Squeeze. If you're laying or sitting, just think of contracting the whole body. And then with your breath, if you want to do 2 more sets of this, it's a nice way to finish this initial round. So from here you have some choices. If your intention was to do this exercise for helping you to fall asleep or fall into a deeper set of relaxation, I'm just going to leave you there. If you are wanting to wake back up whenever that happens, I advise you to just do some of these nice micro movements, really honoring your body's tendency to move, because whenever we do this, this really does in fact help us to wake up. So whatever your intention is with the rest of this exercise, my best wishes are with you for health and happiness.